It comprises of numerous bones. Now, the other day when the vertebra, cervical vertebra, I was telling you, then the joint and the foramen magnum. Now, see, this is the frontal bone. These bones, if you see a fetal skull, even I think we don't have that. Let's see, but you see it in your atlas, the fetal skull. Now, it is the skull comprises of different bones of different shape and size. Now, this is the frontal bone. There are two parietal bones. Posteriorly, there is occipital bone. Laterally, there are two temporal bones. Then zygomatic bone and your maxillary bone. Now, you see, this is the full skull, okay, and the skull is cut open. Now, you see the inners of the inside of the skull. You see the sphenoid. Now, sphenoid has features. Now, you see the base of skull. This is the base of skull. If you cut open, the frontal bone is here, parietal bone is here, the temporal bones are here. Okay. And your occipital bone. Now, the sphenoid bone, it will be taught in a different this thing. Now, the parietal bones, the flat bones, and you see the orbits. The orbits. Now, it has the nasal bones are there. The palatine bones are there, and also your ethmoid bone, the skull, it is kept in a cotton. I'll show you later on. Next class. And which also I kept a wet specimen of the tongue. You just see it because the rest you have to. Now, this is the mandible. Okay. Now, this is the condylar process. These are the conoid process and this is the condylar process. You don't hold it like this. Don't hold it like this. When you are given a mandible, you hold it like this. Like this. You just hold it like this. Okay. Identification. And don't think head neck is, of course, it is in a small space, head and neck. You see the abdomen, if you compare it, it is more wider, more this thing. But in this part, the major components of the human body is located. That is the brain. Now, the brain is to be protected. These muscles are there, but there is no bone. But the bone, the muscles has to be, they are attached and from bony surfaces. And again, they are in the origin and insertion. Okay. Now, don't hold it like this. It happens. I'm telling you the practical aspect. You are holding it like this. No. Why? It is a part of the jaw. Naturally, teeth. Now the teeth, the dental socket is there. The dental socket. Okay. Now this is the conoid process. This is the condylar process. And inside this is foramen lingually. Foramen. The mandibular nerve. Mandibular nerve passes through it. And there are two mental foramen. Mental foramina in the small foramen. The nerve supply comes up to here. The nerve for the teeth, that's why mandibular block. Dentists, they block the mandible. You have to know the anatomy, or you make a local anesthesia. Actually, if you injure or you push in very much, then you will be there will be complications. So you know the basic anatomy. Okay, now you in the human body, living body, you cannot see this. It's covered by mucous membrane. Actually, you have to just locate the third molar and then you block. Okay. Now, this is the Temporomandibular joint. The condylar process is articulating with the mastoid process, the temporal bone. It's the temporal bone. Here's the mastoid, the external auditory meatus. External auditory meatus. Now the mandible is here. Now it is articulating in the temporal bone. You see, when you see it in yourself, you will see. And see, this is styloid process. When I told you about the tongue, it is stylopharyngeus. Okay. And muscle. Now you see through like this. You can see the nasal septum that is separating the two nasal cavities. You have to just see like now temporomandibular joint, TMJ. You see in your books, atlases, it will be. But one thing I tell you, temporomandibular joint is very important. Long question or 10 marks question. I would request you, you are having a tab, download from Gray's Anatomy, just to see the action of the mandible and also the temporomandibular joint. See, some people have some defective your problem with the temporomandibular joint. Some people, if they could shout, suddenly they get a locked jaw. Hey, Shala! So don't abuse any person. Don't abuse any person. So what I'm telling you is the extreme. তুমি কথা তারপরে এমনি করে কথা বলবে না. You be normal. And TMJ, that cartilage, that glides over in the short space. This is short space. See, your glenoidal cavity, the scapula, glenoidal cavity, and the your humerus, and you compare the hip joint with the shoulder joint. Then shoulder joint is a weak joint. It can dislocation of the shoulder, but anytime, like you throw, suddenly you do. Sometimes it is inherent, you get it. Not anyone is having a problem with the shoulder joint? No. So, I am just telling you, similarly, the anatomical disposition, I am comparing with the dislocation of the mandible because of its short space with the temporal bone, the cavity. It glides, if you shout and yell, of course, if you don't have a problem, but you have to be, we don't know, at this age you might get it. Okay. Now, that is the simple thing is that then in the mandible, you know, you identify first. Second thing, hold it in anatomical position. Third thing, the sharp conoid process, condylar, it's condyle, okay, condylar process. That glides in the temporal bone. Now, if you see the mastoid process, you put your hand here and you just put আরো পড়ে ঠিক আছে now this তরমুজ খা একটা তরমুজ খা ঠিক আছে now you can see the mastoid process and in front you can just palpate the Temporomandibular joint TMJ now the sphenoid. I'm just naming the bones. You first know the bones of the skull because I think we missed a class. Actually, it has a greater wing and a lesser wing. Now, this is in the anterior part. You can see it is not this skull's sphenoid, but you can see it like this. Yeah. This is the frontal bone. Hey, Babu, एक बार देख लो, तारपरे feel करे देबे. This is the frontal bone. Okay. Now, this sphenoid, this is the two parietal bones, and portion of the occipital bone is here. This is two parietal. Okay. Now, if you see the ethmoid, this is the crista galli. When it will teach you the inner surface and the sphenoid at the base of the skull. Now there are some openings, foramina. Okay, you have to know here the orbital fissure. And what are the structures going in and out? The structures of the eyeball and the muscles and all. And your pituitary fossa is there. This sphenoid, and this is the maxillary bone. Now it's the hard palate and a soft palate. The maxillary bone, the upper jaw. These are sockets below. This is the hard palate. Okay. And it is forms, and then from the soft palate, that's the lingula is there. Okay. Now, the occipital bone. This articulates with what? Sphenoid. you please study skull bones with the skull. Individual bones of the skull should be studied with the skull. You have this, you read it here. And when the cranial nerves will be taught to you, you have to know through which foramen, which structures are going, which nerve is going. You have beautiful pictures in all atlases. এটা কাদের? Magmin to. Now, Magmin's atlas has very good bones. It is one of the best atlas in real bones and real tissues and muscles. Okay. Now, please, একবার করে দেখে নাও। দেখে নাও আর এখানে ম্যান্ডিবল আছে। This is the zygomatic bone. Zygomatic bone. I told you about one operation. When I taught you scalp, Professor I.T.N. Jackson, American surgeon, facial-maxillary surgeon. তুই ছিলিস না? হ্যাঁ। So he took the parietal bone. He took the parietal bone and took the parietal bone from the skull of the patient, and he made a zygomatic bone with the saw and all this, and put a screw and fixed. That got taken off. तो देखो इधर आओ, हैं ग्रुप्स में आओ, कोई टंग देखो, कोई these are no, I'll tell you, come here. Frontal.
Yes, sir.
These are the two parietal. Frontal, this.
This
This is frontal.
is frontal one.
This
This is parietal and frontal.
parietal,
joint.
two parietal,
Yes, sir.
one frontal, one occipital, two temporal, two temporal,
Yes, sir.
two maxillaries.
Yes, sir. Yes, sir.
Okay, this is the upper jaw,
Yes, sir.
and mandible is the lower jaw. দাদা ঘুমিয়ে যাচ্ছ? না ঘুমো। শোনো, আমি কিন্তু পাওয়ার ন্যাপ পছন্দ করি। পাওয়ার ন্যাপ পছন্দ করি। 10 minutes নিলি তো? I didn't disturb you. এবার দেখে নাও।
I'm asking that it is
না, these are
denticulate or
serrated.
serrated.
Serration. This is a suture.
Yes, sir. Oh, this is sutural.
When a fetal skull, there is they are separate and slowly they come and join. There's এটা দেখা তো fetal skull টা দেখা।
fetal skull টা হ্যাঁ এখানে
চারটে ছবি আছে।
এলিয়েন্স আছে না হ্যাঁ এই যে
এই তো চারটে ছবি। See, these are in this stage. This is all cartilage. That's why when a baby is born,
হ্যাঁ বড়
this rhomboid shaped.
Yes, sir.
If it will be become pulsating. The scalp, over the scalp, the mother will come and tell you, Doctor साहब देखिए इसको क्या इधर दिखाई देता है, इसको ऐसे करता है, हैं? तो बोलेगा नहीं मत सोचो, मेरा ऐसे खोपड़ी हो गया, मैं जब छोटा था, बच्चा था, तो ऐसे ही था.
brain development
Development as in the thing,
brain grow
ossification.
Oh, अच्छा ठीक है.
Slowly, you are growing. Some serrated.
Serrated तो sagittal था.
এইটাও সেরেটেড।
ওটাও সেরেটেড।
হ্যাঁ এই তো দেখো ফ্রন্টাল ফ্রন্টাল বোনের সঙ্গে এই দেখো এই এই তো এটা অক্সিপিটাল,
হুম
এটা এর নয়, যেটা এটা হ্যাঁ এই যে
হুম
হলো সেরেশন